Before I enter my patient's room, I'm checking my meds to assure that I have the correct medicine, the correct patient, and the correct dosage, which I do. I'm now entering my patient's room, assuring that we have privacy. Hello, my name is Ms. Muckle, and I will be assisting you with your intramuscular shot. Can I get your name, date of birth? Great. And can I scan your band? Perfect. So this will be an intramuscular flu shot. This flu shot will stimulate the body's immune to make antibodies. This will be a 0.7 milliliter injection. It does have adverse effects of skin irritation, a little bit of edema, which is a little swelling, and it will also leave a little redness around the injection site. Just letting you know ahead of time. And before we proceed, no allergies to anything, and are you taking any other meds? Perfect. Vitals did come back within normal range, so we are pretty good in that area. So I am now doing my second check of my medicine, just making sure that I do have the correct dosage of everything and the correct meds. I am now performing hand hygiene, putting on my gloves. I am now going to go ahead and help my patient lift up their shirt, their sleeve, wiping it with the alcohol pad. There weren't any lesions or scars in that area, so we were good on that. I am now tapping my ampule a little bit, just to make sure everything is good with it. I'm going to use a gauze to pop it away from myself as I open it. Taking the safety off of my needle here. Kind of sticking it in at level on the table, and I'm not touching the sides of anything. Okay, now withdrawing my 0.7, kind of tilting it to the side a little bit, making sure that it is in the fluid, kind of going a little over 30% here. Okay, now that I have my medicine injected into my needle, I'm going to now make sure that I have the correct dosage, right amount. This is my third check. Tapping it a little bit, seeing a little bubbles. I'm going to go ahead and tap it again, get rid of my bubbles here. Perfect. Using my hand technique to assure that I am injecting in the correct area here. In a 15-degree angle slightly, I'm going to go ahead and slowly injecting my medicine in my patient with my dominant hand here. Safely but fastly withdrawing. Putting my safety back on, discarding it into the proper area. With the gauze here, I'm going to not pressure, but put it over the injection site. I am now getting my bandage here, putting it over my patient, helping them put down their sleeve there. I am now going to take off my gloves here, perform hand hygiene one more time, locking up all of my medicine that I had out, that's already put up. And now I'm going to document where I injected, what I injected, how the patient reacted. I did notice that there weren't any problems as I injected. Area's still good. Great. So before I leave, I'm going to make sure my patient is good. My patient, you're good. Okay? And I'm going to leave the room.